shoelaces, because back in the day, there used to be just black, fairly, oh, you're right, oh my gosh, my knee patient, there we go, okay, so we're doing hip, not knee.
Okay,
So
most people can't do what she just did.
Where, yes, you get very proficient at your reacher use, so if otherwise I've had elastic shoelaces, where I can then, and we talked about this, hopefully it's smooth. If you have a diabetic patient, I might put a little moleskin or something on that to push my shoe off. So if I'm getting my shoe on, I want to make sure it's loose to here, or like to the special laces. Oh, I can put it on, because I can put my
Well, the
sock
thing
on,
is
too.
that for a lot of my patients, they don't come with elastic laces, and their shoes their foot's a little swollen anyway, so I just pre-tie it a little loose. And then pull the tongue down, okay, because that tongue will slide right down when they put it down. And then use your reacher to put it down on the floor, Lisa. Or you
I'm
take
gonna do
your
my
sock off.
socks so that we can
All
do
right.
the legit sock aid, because this is where
Okay,
people.
so hopefully she can get that shoe on without tying
I think I can. I'm gonna give it my best shot. This is where just making sure if you don't have good strength in the hands. The flexible ones are good for some people who have larger feet or different size feet, because I can open it up and flare and get a little bit bigger. You know, I always say, depending on my patient, park the car in the garage, because I need to put my foot, some people, because of the weight of the leg we talked about, it's hard to lift, so they kind of got to cruise out there like that. I'm going to walk in as far as I can, and then I have a sweaty foot, and I'm even going to, I'm going to have to do a little bit of fixing, not bad, but nothing's ever perfect.
Yeah,
I
and
found that
the
there.
plastic ones also come in a bariatric size.
Oh.
I found that out recently, and it's very helpful for your patients that have wider than average foot.
And then if I have decreased circulation or I have issues in my toe, diabetic,
Well,
I
that's
might
what
do
I'm
the
doing.
toes a little bit, like you saw me wiggling my toes, and then I need to grab, there we go, and get a little bit more room. All I'm doing is giving more room between my toes, because it pulls it so tight on my foot, where I need a little bit looser.
So you can lift your foot the way you
And-
leg.
Well, I was showing it for you.
Oh,
I was showing it for you, because
Oh,
I saw
you
you
can do that?
I saw you struggling to look, and I'm like, other than that, come around otherwise.
Now, look, the way she's got her shoe, she could do a two-tool shoe dollar here. But that's helpful, because that.
So if
trauma
I
will slide
can't
right
really
down.
raise my leg up,
Yeah.
I can do this, and see, I can't bend my, say I've got limited knee flexion or hip, I can bring it back. I might have to cruise a little bit. Oh yeah, there we
Yeah, so she did a little wiggle, but
And
be
then just-
careful. What they'll do is they'll put it over here and then totally rotate that way. If that's the case, have them try to do it from the other side, because they're trying to see it.
go. Yeah, because like this,
Yeah,
this
they
is
go like
where
that.
you'll see, and then
And you're like, no, no, no.
where it's like keep your feet forward, or even put the heel down a little bit so you don't find yourself cheating, and they'll want to do that, or look, or just tell them, just push down or push down through here, try to get your foot in the back. So,
Are you
yeah.
able to like lean? So if their foot is down like this, they can do this?
Like
That's
they
okay?
can push
That
on
would
it,
not
it's like,
be, well,
Because
they
you-
can lean to the side, but.
Instead of my leg doing this?
Yeah,
So
I haven't
could
seen
lean
many
in it?
patients do that. I think it's painful to lean on the hip that way.
But
knee patients, you can do that, hip it might be hard to load.
You're moving the hip.
Well, you're gonna move the hip when you walk. You just can't flex it past 90 degrees.
So
Gotcha.
when I was
Yeah.
cheating because of this leg
I've had very
wasn't
few
down,
patients that are fixed. I've had a few. I have had a few that are in what's called a spica cast, or these are people that have had hip replacements and keep dislocating.
right,
So they put them like in a cast or and they have like,
so it
you
goes
know,
all the
they're
way to
like-
here.
they're like here and they can't move past here.
And there's a little
And so they
release
get
button
down
when they
like
go to
this.
sit down, you hit the release,
Yeah.
so you can sit down.
Oh, except with the spica, the one